Cancer rates are climbing rapidly, touching more lives than ever. The real question is whether you would recognize the body's early messages if it were trying to alert you. Welcome to our channel, your source for clear science-grounded guidance, designed to help you get ahead of serious health threats before they escalate. Each year, millions receive a cancer diagnosis, and the trend continues upward. Some forms, including pancreatic and brain cancers, can remain quiet until the disease is advanced. Here is the essential point: catching cancer early can change everything. Recognizing subtle warning signals before progression often leads to far better treatment options and outcomes. You might be thinking that every minor symptom starts to look like cancer once you search online. That is exactly why this video takes a different approach. We move past the noise and anxiety to highlight evidence-based indicators, real signs backed by research that have helped countless people identify problems at an earlier, more treatable stage. Your health is too important to leave to guesswork. Subscribe to our channel, stay attentive to the signals your body sends, and join us as we reveal the 15 critical warning signs that could protect your life. 1. Persistent fatigue. Feeling drained in a way that's out of step with your routine can be an early signal that cancer is developing. When your energy collapses and rest or extra sleep does nothing to restore it, take notice. This isn't simple end-of-day tiredness, it's a heavy ongoing exhaustion that doesn't let up. The pattern is especially associated with conditions such as leukemia or lymphoma. Because these cancers involve the blood and bone marrow, they interfere with the production of healthy blood cells, leaving you depleted no matter how much you try to recover. Alongside this exhaustion, you may notice muscle weakness or episodes of confusion. These can occur when cancers disturb hormone balance or lead to internal bleeding, as can happen with malignancies of the colon or stomach. Once normal body processes are disrupted, a persistent low-energy state and related symptoms often follow. What makes this tricky is that long-lasting fatigue is easy to dismiss as stress or overwork. If you remain unusually tired for a prolonged period, make an appointment with a physician. Appropriate evaluations can reveal whether there is an underlying problem that needs attention. 2. Persistent headache. A headache that refuses to fade even after using over-the-counter remedies or prescribed drugs deserves serious attention. When head pain stretches beyond 2 weeks, schedule a medical evaluation. Persistent headaches of this sort can be a red flag for conditions affecting the brain, including tumors and other forms of brain cancer. Neurological changes can travel alongside the pain. Watch for blurred or double vision alterations in hearing or drooping on one side of the face. Seizures and other unusual neurological episodes also warrant urgent assessment by a clinician. These features suggest that something within the brain may be interfering with normal function. Tumors, for example, can compress nerves and nearby structures, producing these symptoms. It is risky to ignore a long-lasting headache that resists typical treatments. Most headaches are not cancer-related, but those that persist and fail to respond should be investigated thoroughly. Detecting the cause early can dramatically influence treatment options and overall outcomes for brain tumors and related disorders. Pay attention to what your body is signaling. If the headache continues and is accompanied by neurological signs, seek medical care without delay so you receive the appropriate evaluation and support. 3. Body rash. Not all skin changes are harmless, and certain rashes warrant prompt medical evaluation. Leukemia, a cancer of the blood-forming tissues, can reveal itself through distinctive skin findings that are easy to mistake for minor issues. What sets them apart is their appearance and behavior. Petechiae are tiny round pinpoint marks on the skin caused by low platelet counts, a frequent consequence of leukemia. Typically measuring 1 to 2 millimeters, these spots do not blanch or fade when pressed. Their color can range from red to purple or brown, and they often cluster in areas exposed to pressure, such as around snug clothing or near the ankles. Understanding why these spots form helps make sense of the warning. Leukemia interferes with the production of healthy platelets, the cells that help prevent bleeding. With platelets in short supply, fragile capillaries can leak, producing the characteristic petechial pattern. Unlike ordinary rashes that may itch and clear within a few days, rashes related to leukemia tend to persist and may show up alongside other concerning signs, including unexplained bruising or episodes of bleeding. 4. Changes in urinary or bowel habits. Have your bathroom patterns shifted recently? Persistent changes in how you pass stool or urine can be an early clue that something in your body needs attention. When constipation or diarrhea continues for weeks rather than days, schedule a medical evaluation. While these issues can seem minor, they may point to significant conditions, including cancer. Altered bowel habits sometimes stem from inflammatory bowel diseases such as Crohn's, yet they can also reflect cancers of the colon or stomach. Tumors and inflammation can disrupt normal digestion and motility, leading to differences in frequency, stool consistency, and overall comfort during bowel movements. Urinary changes deserve the same vigilance. Pain with urination going more often than usual or a weakened stream can signal problems ranging from a urinary tract infection or enlarged prostate to more serious concerns like prostate or bladder cancer. If you observe these patterns, don't ignore them. Many benign conditions can cause similar symptoms, but they may also serve as early warnings of malignancy. It's wiser to investigate and rule out serious causes than to delay and face a progressing, potentially treatable disease. Staying proactive means listening to your body's signals. When changes in urinary or bowel habits persist, consult a healthcare professional. Early recognition and timely care can markedly improve outcomes for colon, stomach, prostate, and bladder cancers. 5. Persistent heartburn. Ongoing heartburn, clinically referred to as gastroesophageal reflux disease or GERD, may seem like a minor nuisance, but when it continues despite lifestyle adjustments and medication, it can point to something more serious. Esophageal cancer can initially present as reflux that refuses to improve with standard therapies. The connection stems from repeated acid injury to the esophageal lining. With time, stomach acid can alter the cells that line the esophagus, producing Barrett's esophagus, a precancerous state that markedly elevates the risk of esophageal adenocarcinoma. Be alert to additional red flags, such as difficulty swallowing, the sensation of food sticking, or unexpected weight loss occurring alongside chronic heartburn. If you have been relying on over-the-counter remedies for longer than 3 weeks without relief, arrange an evaluation with a healthcare professional. This is only the start. In the next segment of this video, we will explore more potential warning signs to help you stay ahead of serious health issues. 6. Mouth sores that won't heal. Noticing a sore in your mouth that lingers beyond a couple of weeks is a reason to act. Ulcers, lesions, or white patches on the lips, tongue, gums, or elsewhere in the oral cavity that refuse to clear up should be evaluated, as they may signal oral cancer. This disease can arise in any part of the mouth, including the lips, tongue, and throat, and the risk increases for people who use tobacco or drink alcohol heavily. Persistent sores deserve particular attention when they come with additional problems such as trouble swallowing or unexplained weight loss. White patches, known as leukoplakia, are another important warning. Although they may appear harmless, leukoplakia is a precancerous change that can progress to cancer if left untreated. A healthcare professional should assess these areas to determine the right next steps. Delaying care can have serious consequences because oral cancers can be aggressive and outcomes improve with early detection. If a mouth sore isn't healing, arrange a prompt medical evaluation. 7. Blood in the urine or stool. Finding blood where it doesn't belong is a warning that demands attention. Traces in the stool may appear bright red, darker red, or take on a black tar-like appearance, while urine can look pink, red, or even dark brown. Such changes can point to serious problems, cancer among them. Bleeding from the lower digestive tract may reflect conditions like colon or rectal cancer, and it can also occur with inflammatory bowel disease, including ulcerative colitis, which disrupts normal gut function and leads to irritation, bleeding. Blood visible in the urine can signal issues such as prostate or bladder cancer, though infections and other urinary tract disorders are also possible culprits. Regardless of the source, the presence of blood is a clear sign that something is wrong and needs professional evaluation. If you observe blood in either urine or stool, arrange prompt medical care. Quick assessment helps determine the cause and guides the right treatment. Your health is too important to overlook these signals. 8. A cough or hoarseness that won't go away. Dealing with a cough that refuses to resolve deserves attention. When a dry, persistent cough or lingering hoarseness lasts beyond 2 weeks, arrange a medical checkup. A nagging, hacking cough that doesn't improve can be a sign of lung cancer, and coughing up blood or blood-streaked mucus is especially worrisome and requires urgent care. Voice changes that stick around, raspiness, strain, or a voice that sounds different day after day also merit evaluation. When hoarseness shows up with trouble swallowing or pain in the neck or throat, it can point toward problems involving the thyroid or the tissues of the throat. These symptoms are easy to dismiss as minor irritation, yet persistence raises the possibility of more serious disease. Chronic cough is a common feature of lung cancer and may not respond to usual remedies. Pay close attention to what your body is telling you. If coughing or hoarseness continues for longer than 2 weeks, speak with a healthcare professional to determine the cause and the best course of treatment. 9. Excessive bruising. Bruises showing up without an obvious cause, especially in unusual locations, deserve prompt attention. Unexplained frequent bruising can signal problems with blood cells and may be associated with certain blood cancers. In leukemia, for example, the body's ability to form healthy blood components is impaired, which can lead to easy or excessive bruising. You might notice these marks on the arms, legs, or areas where you wouldn't normally expect them. This isn't something to brush off, as it can be an early indicator of a serious underlying issue. Pay attention to accompanying signs as well. Recurrent nosebleeds or bleeding gums may point to blood disorders or malignancies affecting normal clotting and platelet function. If these symptoms appear, arrange an evaluation with a healthcare professional. Tracking changes like unexplained bruising and seeking timely care can make a meaningful difference in diagnosis, treatment, and overall outcomes. 10. Eye pain. Your eyes can offer early clues about broader health problems, including possible malignancies. Although uncommon, overall ocular melanoma is the most frequent primary eye cancer in adults. Its warning signs often start quietly before evolving into more obvious changes that should not be overlooked. When a tumor forms within the eye, the symptoms differ from routine eye complaints. You may notice persistent blurred vision that doesn't improve with an updated prescription or experience unexplained flashes of light unrelated to migraines. One of the most worrisome features is a dark spot on the iris that slowly shifts in size or color over time. Precise diagnosis relies on specialized evaluation, with ophthalmoscopy and other advanced imaging playing a central role. Certain factors raise risk, including fair skin and light-colored eyes. Do not ignore ongoing eye pain or lasting changes in how you see. Acting early can safeguard both sight and overall health. Regular comprehensive eye exams are especially important if you have risk factors such as long-term sun exposure or a family history of eye cancer. 11. Bone pain. Persistent bone pain is an easily missed warning that deserves attention. Unlike soreness from a workout or a minor strain, cancer-related discomfort tends to build over time and often feels worse at night. When a malignancy begins in bone or spreads there, it disrupts normal structure and triggers a deep, penetrating ache that's hard to ignore. Primary bone cancer, or osteosarcoma, commonly involves the long bones of the arms and legs. The pain may start subtly mistaken for a sprain or muscle tension, but gradually becomes steady, stronger, and more intrusive. Daily tasks can grow difficult as movement provokes worsening discomfort. Many people describe a throbbing or dull ache that doesn't improve with standard pain medications. Watch for additional signs such as swelling, localized tenderness, or fractures that occur without a clear cause. These features heighten concern and call for prompt medical evaluation. Detecting bone cancer early can markedly improve treatment prospects, with outcomes significantly better when the disease is identified at an initial stage. Tall fingernail marks. Subungual melanoma is a skin cancer that arises beneath the nail and often begins as what looks like a harmless vertical stripe. This dark band, called melanonychia striata, runs along the nail's length and needs close observation. Unlike typical nail pigmentation, malignant streaks tend to appear abruptly and continue to change over time. The thumb and big toe are the most frequent sites, though any nail can be affected. Its danger lies in how easily it's mistaken for everyday nail trauma or a fungal infection. Pay attention to defining features, such as a stripe wider than 3 mm, multiple shades within the band, or edges that look smudged rather than sharp. Learn to recognize Hutchinson's sign, where the dark pigment spreads beyond the nail plate onto the surrounding skin. Seek medical evaluation without delay if these nail changes come with pain, splitting, or bleeding. These signals are among the body's early warnings. Identifying them promptly can be pivotal for timely cancer detection and effective treatment. 13. New or unexplained pain. Is a lingering ache troubling you without a clear cause? Discomfort that lacks an obvious trigger, such as injury or illness, and fails to improve with usual measures, should be assessed by a clinician. Pain is the body's alarm system. When it persists without explanation, cancer can be one of the possibilities. In men, abdominal pain may point toward disease involving the prostate, bladder, testicles, or penis. For women, unusual breast tenderness or pain that stands apart from normal cycles can be a warning sign of breast cancer. This type of discomfort doesn't behave like everyday soreness and doesn't resolve with routine remedies, suggesting a more serious underlying issue. Internal malignancies can also announce themselves through persistent pain. A sense of heaviness, swelling, or ongoing discomfort in the scrotum may indicate testicular cancer. Continuous abdominal pain can raise concern for problems involving organs such as the liver or pancreas. These patterns are easy to dismiss or attribute to minor conditions, but they warrant closer evaluation. Overlooking unexplained pain is risky. If discomfort endures and cannot be linked to a known reason, it should be investigated to determine what's driving it. Early attention improves the chance of finding the cause and addressing it effectively. 14. Jaundice. Have you observed a yellow tint to your skin or the whites of your eyes? Jaundice caused by an accumulation of bilirubin develops when the body cannot process and clear this pigment efficiently. Although many conditions can produce jaundice, a sudden onset in adults is particularly concerning for cancers of the pancreas or liver. In pancreatic cancer, a tumor may block the bile duct, interrupting normal bilirubin flow. This obstruction forces bile components into the bloodstream, leading to the yellow discoloration of the skin and eyes. The change can begin subtly, then grow more noticeable as the problem advances. Because the pancreas sits deep within the abdomen, early disease can be hard to detect. That makes recognizing jaundice especially important, notably when it appears alongside symptoms such as pain in the upper abdomen, dark urine, or stools that look unusually pale. 15. Persistent fever. Fever that lingers or keeps returning without a clear explanation can be a signal of blood cancers. Unlike routine fevers that settle within a few days, cancer-related fevers often follow recognizable patterns and appear alongside other whole-body symptoms. In leukemia and lymphoma, the immune system may release cytokines that provoke recurrent temperature elevations. These episodes can arise in the absence of obvious infection and frequently occur with night sweats or unexplained weight loss. Some people notice rhythmic spikes at predictable intervals, a presentation known as cyclic fever. When a fever lasts beyond 2 weeks or repeatedly returns without an identifiable cause, it should prompt a medical workup. Blood cancers can weaken the immune defenses, increasing vulnerability to infections, while also directly producing fever. A proper evaluation typically includes laboratory studies, such as complete blood counts and related markers, to look for abnormal cells and other signs of disease. Early assessment helps clarify the source and guides timely treatment. Cancer can show up in ways you don't expect, and the sooner you recognize the signals, the better your chances. Your body speaks when something is off. Don't overlook it. Noticing these symptoms may be the first move toward early diagnosis and treatment that saves lives. If this video helped you, tap like and share it with friends and family. Someone you know might need it. Subscribe to our channel for trusted, expert-informed guidance that helps you take charge of your health. Your well-being is your most valuable asset, and knowledge is your strongest shield. Stay informed, stay proactive, and look after yourself. We'll see you in the next video. Until then, stay healthy, stay strong.